Cranberry Township is pleased to announce that through collaborative efforts between the Cranberry Township Capital Fund, Cranberry Township Community Chest, and the Passavant Hospital Foundation, the AEDs throughout the township parks and facilities will be replaced with up-to-date standard model. The Passavant Hospital Foundation funded the strategic placement of AEDs throughout our community parks. At the same time, the capital funds in Cranberry Township Community Chest facilitated replacing the other devices throughout the township. In this video, we will briefly explain the AED operations, attached accessory equipment, and what to do once the AED is used. So let's take a closer look at the actual device. The CR2 is a semi-automatic device requiring someone to push the shock button if prompted. There is an outer protective case and an inner hard plastic lid. The machine turns on when the inner hard plastic lid is opened. One can access the pads by pulling the red handle when prompted by the AED. The pads have both adult and child placement pictures as a reference. There are 4 buttons across the top of the AED. The language button, the on-off button, the child button, the shock button. English will be the default language. Bystander rescuers should not have to use the on-off button. Rescuers will press the child button for anyone under the age of 8, ensuring to use child placement of the pads. The shock button will only be active when the AED recognizes that a shock is needed. Remember, once you open the lid and the device turns on, follow the prompts and never take the pads off or try to turn off the device. EMS will take care of those steps. Each AED will have a responder get ready kit attached. This kit is where the rescuer will find scissors to remove clothes, a razor for hairy chests, a towel for drying the patient's chest, gloves for removing medication patches. The bag will also have a pocket mask for giving breaths. As a quick review, to use the pocket mask, you will have to push it up in the center of the mask to pop it into shape. Then place the point over the patient's nose and press down around the bottom of the mask to seal it to the patient's face, providing breaths as you normally would.